Dr. Waterhouse, what factors determine the prognosis of critically ill patients?
Well, you can imagine that it's a very difficult topic to study, the factors that determine prognosis in critically ill patients. But there seem to be three main factors that will predict outcome when outcome is defined as mortality. So the first factor would be the age of the patient. And the older the patient gets, the higher likelihood of death or mortality associated with seizures and status in the ICU. The second factor is the etiology of the seizures. So there are some etiologies that we know have a much worse prognosis than others. For instance, people who have anoxic brain injuries, say following a cardiac arrest and then go into status, have a very high likelihood of dying. Other etiologies that have poor outcomes are things like severe acute strokes and certain kinds of brain tumors. There are other kinds of etiologies, though, that actually are associated with a more favorable outcome, and that mainly is a history of epilepsy. So if there is a history of prior seizures prior to the ICU stay, then those people tend to have a relatively favorable outcome. So the third factor is the length of the seizures, the duration, or the seizure burden. So the longer duration or the more refractory the person is to treatment, with seizures continuing despite treatment, the worse the outcome is likely to be.
So along those lines, is there evidence that early treatment or aggressive treatment at the beginning can make a difference in outcome?
There is evidence that early treatment is associated with a better mortality. So the faster that you can get your treatment in, the better. And that's why in certain localities, treatment is even started in the ambulance. What is more difficult to study and to have data on is whether aggressive treatment predicts outcome. We know that if we can shorten the duration, that will improve outcome, but sometimes overly aggressive treatment can actually impact the outcome as well. So that's kind of an area for future research in terms of how well do our treatments in the ICU affect outcome.
Thank you very much, Dr. Waterhouse.
You're welcome.